Hello everyone, myself Sandhya Suryanshi. I am studying in second year MBBS. So today we will discuss about drug interactions. So drug interactions is defined as the pharmacological activity of one drug being altered by concomitant means continuous use of another drug or by presence of some other substances. The outcomes of drug interactions are beneficial and harmful. Beneficial outcomes are do not causes any risk to the patient. For example, amoxicillin and clavulanic acid. The another example is sulfadoxine and pyrimethamine. The harmful outcomes losses the therapeutic effect and toxicity should be occur. So, factor contributing drug interactions like multiple diseases or predisposing illness, multiple drug therapy, multiple prescribers, poor patient compliance to instructions, advancing age of patient, and drug related factors. So, which drugs commonly involved in drug interactions are the drug with narrow safety margins like aminoglycosides, digoxin, lithium. The another one is drug affecting closely regulated body functions like antihypertensive, antidiabetic, anticoagulants. The another one is highly plasma protein bound drugs like NSAIDs, oral anticoagulants, and sulfonylureas. The last one is drug metabolized by saturation kinetics like phenytoin, theophylline. So, types of drug interactions there are three like drug-drug interactions, drug-food interactions, and drug-disease interactions. So, we will see mechanism of drug interaction. There are three mechanisms by which interaction can occur. One, pharmaceutical interaction. Second, pharmacokinetic interactions. Third, pharmacodynamic interaction. So, we will discuss about pharmaceutical interaction. So, certain drugs react with each other and get inactivated if their solution are mixed before administration. Means, in a practice, these in vitro interactions occur when injectable drugs are mixed in a same syringe or infusion bottle. For example, diazepam, which is an injectable drug mixed with infusion fluid. So, precipitation occur. The other example is phenytoin mixed with infusion fluid. So, precipitation occur. So, these all are the example of the pharmaceutical interactions. So, now we will see pharmacokinetic interactions. They are divided into four interactions: absorption, distribution, metabolism, and excretion. So, first of all, we will see about absorption interactions. Absorption interaction is take place by five processes like altered pH, formation of drug chelate complexes, drug induced mucosal damage, altered GIT motility, and altered bacterial flora. So, first, altered pH means non-ionized form more lipid soluble and more readily absorbed from GIT than the ionized form. For example, antacid and H2 antagonists mixed before the administration, so pH decreases, means decrease the tablet dissolution of ketoconazole, means therefore these drugs mix must be separated by at least 2 hours in the time before administration of both. The next, complexion or chelation. For example, tetracycline interact with iron preparation or milk containing calcium ion, so unabsorbable complex form. The another one is antacid like aluminum or magnesium hydroxide decreases the absorption of tetracycline by 85% due to chelation. The third one is drug induced mucosal damage. Antineoplastic agents like cyclophosphamide, procarbazine, they inhibit the absorption of several drugs like digoxin. Fourth one is altered motility. Metoclopramide, it is an anti-emetic drug which is increases the concentration of the cyclosporine and absorption of the cyclosporine and due to increasing stomach emptying. So increasing toxicity of the cyclosporine. The last one is altered intestinal bacterial flora. In 10% of the patient receiving digoxin, means 40% or more of administered dose is metabolized by intestinal flora. For example, broad spectrum antibiotics kill a large number of flora of intestine, means increase the digoxin concentration and increases the toxicity. So next we will see distribution interaction. So distribution means the pattern of object is altered. The major mechanism involved is one drug displaces the other drug by from its protein drug binding site. For example, displacer phenylbutazone or chlorohydrate displace the anticoagulants. So anticoagulants are free and their concentration increases. So increase clotting time, increase the risk of hemorrhage. The another example is sulfonamide, which displace the tobutamide, so increase hypoglycemic effect. The next interaction is metabolism interaction. Metabolism interaction means enhance or reduce the metabolism of certain drug by the other drug. Takes place by two processes: enzyme induction and enzyme inhibition. Enzyme induction means a drug may induce the enzyme that responsible for the metabolism of drug or even itself. For example, rifampicin decreases the plasma concentration of oral contraceptive pills, means contraceptive failures occur. The another one is enzyme inhibition, means decrease in rate of metabolism of drug by another. This will lead to increasing concentration of target drug, leading to increased toxicity. For example, erythromycin increases the plasma concentration of terpentine, so cardiotoxicity should be occur. The last one is excretion interactions, means here one drug inhibit the active tubular secretions of other drug. For example, probenecid is inhibit the active tubular secretion of penicillin and cephalosporin, so elevated plasma level of acidic drug occur. The another example is non-steroidal anti-inflammatory drugs inhibit the lithium bicarbonate, so decrease the renal clearance of lithium and risk of toxicity. So now we will see pharmacodynamic interactions, means modification of action of one drug at the target site by another drug independent of the change of the concentration may result synergism, additive effect and antagonism. First of all, we will see synergism, means when therapeutic or toxic effect of two drugs are greater than sum of the effect of the individual drug. For example, combination of sulfamethoxazole and trimethorphan is used as antimicrobial agent. The next one is additive effect. Net effect of two drugs used together is equal to sum of the individual of drug effect. For example, combination of thiazide diuretics and beta adrenergic blocking drug is used for treatment of hypertension. The third one is antagonism. The effect of one drug can be reduced or abolished by presence of another drug. For example, blockage of antiparkinsonian, action of levodopa by neuroleptics and metoclopramide having antidopaminergic action. So now we will see drug food interactions. For example, garlic when combined with diabetic medication could cause dangerous decrease in blood sugar level. Some garlic sensitive individuals may experience heartburn, flatulence. Garlic is also an anti-clotting property, means interaction with anticoagulants. Another example is organic juice must not be consumed with antacid containing aluminium. The juice increases the absorption of aluminium and leads to constipation. For another example is milk contains elements like magnesium, calcium, which chelate the antibiotics like tetracycline and hence decrease the absorption and effect. The another one is vitamin K rich food reduce the effectiveness of anticoagulants such as warfarin, increase the risk of clotting. The last one is fiber in oatmeal and other cereals. When consumed in large amount can interfere with absorption of decoxin. The last interaction is drug disease interactions. Means drug disease interaction occurs when drug worsen or exacerbate an existing medical condition. For example, hypertensive patient after administration of nasal decongestant, the blood pressure is increases. The already asthmatic patient after administration of non-steroidal anti-inflammatory drug, the airway obstruction should be occur. So lastly we will see drug interaction before administration. Certain drugs react with each other and get inactivated if their solution are mixed before administration. For example, penicillin G or ampicillin mixed with gentamicin or another aminoglycosidic antibiotic. The second one is thiabantine sodium when mixed with succinate codeine or morphine. The last one is heparin when mixed with penicillin, gentamicin or the hydrocortisone. Means in general it is advisable to avoid mixing of any two or more parenteral drug before injecting. So now we will discuss some MCQs. The first question is outcome of drug interaction. Option A is beneficial, B is harmful, C both A and B, D is none of this. So the correct answer is option C, both A and B. The second question is which of the following is not a pharmacodynamic interaction? Option A synergism, option B additive effect, option C distribution, option D antagonism. So the answer is option C, distribution. The third question is which of the following is not a pharmacokinetic interaction? Option A is absorption, option B is antagonism, option C is distribution, option D is metabolism. So the correct answer is option B, antagonism. Option Question 4. In which pharmacokinetic interaction formation of drug chelate can occur? Option A absorption, option C metabolism, option B distribution, option D excretion. So the correct answer is option A absorption. The last question is pattern of object altered in which interaction? Option A absorption, option B metabolism, option C distribution, and option D is excretion. So the correct answer is option C, distribution. So this is all about my topic. Thank you.